Kasaharam Parak. Here, it is the site of action is Udanavata and Vyanavata. The medicine is Ushna, Lakhu, Vata Samana, Deepana and Grahi. Always think here this Grahi is not the Grahi. Always we have a misconception of this Grahi. When we say this Grahi, most of us think that causes constipation. But it is not. The term Grahi is not is not the Dravya which causes constipation. See, the Deepanam, if a yoga is Deepanam, Pajanam Yattat, Ushnatva Dravashoshakam, Grahi Tatsetha Shundi, Deepanam Gajavipadi, Jirakam Gajavipadi. So, if a Dravya which has got a properties like Deepana as well as Pachana, and by its Ushna nature, if it reduces the excessive Jaliya bhava from the body, maybe extracellular fluid or whatever it may be, it can be done as Grahi. So always never think that Grahi is not the medicine, not the group of medicine that cause constipation. Grahi can be given in many other conditions where you are suffering with the Kleda predominant conditions. It can be given in postnasal drip, severe running nose, etc. The Grahi medicines are very effective. So such thing, whenever there is Kleda Pradhana, you can select this Grahi as an option. Now here also, in the case of fever also, there is no much relation with fever, this yogas also. Again, like Nayopayam, dry or various sputum. The nature of sputum is also similar with Nayopayam. Exertional dyspnea, chronic asthma. And here also GIT, again as Nayopayam, this also is very effective in conditions like acid peptide disorder, abdominal distension, spasmodic abdominal pain. Now we will see difference. Nayopayam is both are Vada Samana. But at the same, Nayopayam is Vada Samana, which is not Kapha Vardaka. This Balajiragadi also Vada Kapha Samana. Vadadhika Vada Kapha Samana. Nayopayam is simple Vada Samana. This is the difference between them. Both are Ushna. Grahi property is more with Balajiragadi. Deepana Pajana properties are more with Balajiragadi comparing to Nayopayam. This Kapha Nisaragatva action is absolutely not there with Nayopayam. So that you should be very careful regarding. If a patient exhibit with severe productive cough, with what we say the purulent cough, etc. If we select this Nayopayam or Balajiragadi, the result may not be satisfactory. So always you should think of this type of possibilities. Now the other medicine, that is Ela Kanati. Ela Kana Matuga Nagara Abdavasa, Nimbamradambu, Dashamula, Sudakashayan. Again here comes this Dashamula. The Anubana as Laksha, Sita, Matuga, Jiraka, Sampayukta. There are 4 types of Anubanas, that is Laksha, Sita, Matuga, and Jiraka. This Vaidyratnam Aushadha Shala produces this Lakshadi, this medicine, this Anubana as Lakshadi Churna. That is Laksha, Sita, Matuga, and Jiraka. Now when we come to the properties, it can be effective in occasional with a mild fever. Acute exacerbation of chronic diseases like COPD. If the patient has a COPD patient, there can be acute exacerbation because of any of the type of Nidana Sevana. There can be an acute exacerbation. In such conditions, comparing to the other medicines, this Ela Kanati is found to be more effective. If the nature of sputum is acute, the thick, purulent, and if the patient says that I am getting the relief once I spit the sputum. So this medicine here you can select this Ela Kanati. Again, exertional dyspnea, fatigue as well as lethargy. Anorexia, this aruchi or abdominal distension or vomiting, GIT symptoms. Here also you can select this Ela Kanati. So always the thing is the Ela Kanati is more stronger comparing to Nayopayam and Balajiragadi, but less stronger, less Tikshna by comparing to Vyagradi and Dashmula. These are the common kashayas. Now we will see some of the avalehas as well as churnas. I think we can finish within 15 minutes. So there are so many avalehas on the markets. There is Agastya Rasayanam, there is Kushmanda Rasayanam, Mridugadi Lekhyam is there, Talisavatradi Lekhyam is there, Drakshadi Lekhyam is there, then Vasishta Rasayanam is there. These are some of the lehyas which has got indication with the Kasa and Swasa. Where do we have to give this Agastya Rasayanam? Where we have to prescribe Mridugadi Lekhyam? Where we have to prescribe Drakshadi Lekhyam? Where we have to prescribe Kushmanda Rasayanam? That we will see now. For that purpose, we will compare this Agastya Rasayanam and two similar yogas with almost similar ingredients. We will compare with Agastya Rasayana as well as Vasishta Rasayana. So the key ingredients of this Agastya Rasayana are nothing but Dashamoola, Swayangupta, Dashamoola Swayang Hasti Vipalya Apamargam, Pippali Moola Chitraka. And Yava Atakam. Yava becomes the key ingredient in the Agastya Rasayana. The other ingredients like Krita, Taila and Guda are also presented here. The action of Dhadu is Rasa. Then the site of action is Amasya and Parshashula. Then the karma, the indications are, there are some interesting indications. That is that Vali Palidanasana, Panchakasa and Swasam, Itma, Gulmam, this Vali Palidam, etc. There are some of the other unexpected indications here. So here now we will see what are the, why Acharya included this. See, there are some unexpected ingredients also, isn't it? Dashamoola Swayangupta, Hasti Vipalya Apamargam, Haridagi Sadam Cheva, Yavanam Athagam Jata. Haridagi and Yava. Why Yava included in this type of condition? In this, Yava came here as a main chief ingredient. What could be the reason? Why Acharya included Yava? And why Acharya included Dhrita, Taila and Guda? So that is the common, when we understand that, this reason, we will find out the exact point, we will find out the exact nature of the yoga. So Yava is nothing but, we know the Ruksha Shidosha Guru Swada, Ruksha Shido Guru Swada, Saro with Vadagrit Yava. With Vadakrit Yava. Yava is Vata Varthana. And why Acharya explained a Vata Varthana Drivya in Agastya Rasayana, a yoga with a Vada, which has got a Viguna Gati of Vata. Nothing, you can see the Avarana. Here comes the importance of Avarana. Yavanam Vigriksharam, which I explained previously. That's why what we say, the Yava is nothing. Ruksha Shido Guru Swada Sarovit Vadagrit Yava. Here also, when we comes to the properties of this Yava, again the another indication is where we have to do this Yava. This was then why we should give given this Abhaya. Swinna Sangrahini. Abhaya, we are adding this Abhaya as after this boiling with that. When we go to Bhava Prakasha, Acharya explained that Charvida Vardhayatekni, Peshida Marashodhini, Swinna Sangrahini. The Swinna Haridagi. In this condition, we are adding this Swinna Haridagi. Swinna Haridagi is Sangrahi. To prevent the Sangrahi nature of that, or the Grahitva, Acharya added this Krita. It's to balance the Grahi nature of Abhaya. Swinna Haridagi, Acharya added this Buddha as an antidote. Then Kabhavrde Yavanani Jangaran Mugavakshino. Kabhavrda Vata. The best medicine is nothing but Yava. But at the same time, Yava is Vata Varthana also. To compensate the Vata Varthana Sobhava, Vata Varthana character of Yava, Acharya added Taila and Krita here. So this could be the logic behind this, the inclusion of Abhaya, Yava, the unexpected ingredients like Abhaya, Yava, Buddha and Taila Krita. So here also, where we have to give Agastya Rasayana. Better not to give this Agastya Rasayana as an initial step of medicine, because it needs proper Agni. This can be given as a Rasayana. Once the first line of treatment has been finished, that is first Samana line has been finished, or first Anulomana line has been finished, then we have to give this we can give this Agastya Rasayana as a Rasayana therapy. Not Agastya Rasayana has not Rasayana. It's a Rasayana. It is not a Samana treatment. Definitely, it is not a good option in case of acute exacerbations. And again, the best option in the conditions, along with the respiratory conditions, along with the GAT symptoms, that is with the constipation, with what we say, the excessive abdominal distension, excessive burning sensation, etc. If the patient exhibit, the wheezing patient exhibit these kind of symptoms, the best option will be Agastya Rasayana. Now we will see the Mrudyugadi as well as Drakshadi Lega, which has got almost similar combination. Mrudyugadi, Mrudyuga, Pippali and Sharkara. These are the main ingredients. In the case of Drakshadi, Draksha, Pippali, Sarkara, with Madhuka, Shundi, Tugakshiri, and Dhatri Surasa. So again, as I told previously, fortified Nayopayam is Balaji Revadi. We can say as fortified Mridugadi is Draksha. The method of preparation is different. Mridugadi, what we have, it's not doing as a Lehya Paka. We are just pounding all the ingredients together and making into a Lehya Paka. At the same time, Drakshadi, we are doing as the preparation method is as a Tavaleya Paka. Sahapana is Madhu. Indication, typically Mridugadi is indicated in Paitiya Kasa. The textual indication is of Drakshadi is nothing but Halimagam, Pandu, and Kamala, but there is no indication in Kasa and Shwasa. So, but by considering the ingredients, we can see that the Drakshadi is equally effective in this type of respiratory pathologies also along with the other one. So now we will see the action of that. Mridugadi and Drakshadi are Pitta Kapsamana. Mridugadi is Kabhadika Pitta Kapsamana. At the same time, Drakshadi is Pittadika Pitta Kapsamana. Both the medicines are equally effective in Prana, Rasa, and Rakta Vasodas. Mridugadi, Drakshadi is more effective in Prana Vasodas, Rasa Vasodas, and Rakta Vasodas. Because that's why the Acharya included this Grahani, Pandu, etc. as an indication. Mridugadi has got Chedana, Lekana, and Kapanisarga property. At the same time, Drakshadi is more Samana. Kapanisarga, Balya, and Rasayana. The Rasayana Subhava is not there with the Mridugadi. Mridugadi is more of Shamana as well as Drakshadi is more of Rasayana. These are the difference between both. So, now we will go to the first part. Mridugadi can be given in Paitiga Kasa with Ghanakappa, and Drakshadi can be given in Paitiga Kasa with the Tanukappa. Typically, as a spoon feeding, we can say that Paitiga Kasa with the Ghanakappa, Mridugadi. Blindly you can prescribe. Paitiga Kasa with the Tanukappa, Drakshadi. Just feed this. Now, Talisapatradi Vatakam, only one or two are there remaining. Talisapatradi Vatakam and Talisapatradi Leham. Both are just one different. Both these medicines. That is, ingredients are Talisapatra Chaviga, Marija, Tippali, Shunti. At the same time, in case of Talisapatradi Lehya, in place of Shunti, Shunti is replaced with Abhaya. Abhaya Nagarasthani, Dadyada, Traja Vigrahi. So, but one is Vataga and the another is Leha. That is the main difference. The Anubanas explained that Madhya Yusha Rasa, Arishta, Mastu, Peya, and Paya. And Talisapatradi, in which kind of patients or which kind of symptoms we can give Talisapatradi Vataga, in which time we can give Talisapatradi Leha. Typically, Vada Kapacha Kasa Swasa with normal wit Pravartana. If the bowel movements are normal, you can opt this Talisapatradi Vataga. At the same time, if the same kind of symptoms along with Graha as a symptom, if the patient exhibits constipation as a symptom, the best option will be Talisapatradi Leha. So always think Talisapatradi Vataga is not a universal medicine in Vasa and Swasa. It has got a specific indication. It is Vata Kapasamana. Only the patient with Vata Kapa predominant Kasa Swasa you give that too with the normal wit Pravartana. Because it has got a tendency to reduce the excessive Grahya Jalamsha from the Koshta, and that produces Vitranta. At the same time, because of the replacement of Shunti with Abhaya, the Talisapatradi Lehya becomes with Pravartana. This is the difference. So, both are Vata Kapasamana only. Talisapatradi Vataka is Kapadiga Vata Kapasamana, and Talisapatradi Lehya is Vadadiga Vata Kapasamana. The Srodho Shodhana properties are almost similar. Both the medicines are Pachana, Deepana, Kleda Shoshana, and Ruchya. At the same time, Talisapatradi Vataka is Grahi and Talisapatradi Lehya is Analogana. These are the differences. Now, the one Kushmandra Saka. Nishkuligirti, we know that Nishkuligirti Kushmanda, Nikshipati Gunam Shive, like that it continues. The main ingredients are Kushmanda, Siddhaganda, etc. The medium is ghee only. It is Vada Kapasamana because the indication is nothing but Shataja Kasa. So, action on Dhadu, which is Rasayana, Rasa, Rakta, and Mamsa, and Medas. Site of action is Uras and Shaka, which is Brahmana as well as Rasayana. Indications are Kasa, Hitma, Jwara, Swasa, Rekta, Pitta, and Urasanthanagara is nothing but Krataja and Traja Kasa. Urakshada. Urasanthanagara means nothing but Urakshada, that is Krataja Kasa. So Usman Rasayana is the best option as a Rasayana in chronic condition. Again, as I told you, Rasayana. Once the debilitating disorders, after the proper Samana therapies, you can select this Usman Rasayana as a Prasha or even as a Rasayana for a long time. Definitely, it is Kapha Vardhana in nature, and thereby you are not supposed to give it the acute exacerbation. And it is, the yoga is not Vajana or Kapha Nisaraka. It is purely of Brahmana as well as Rasa. Now, by comparing this, by analyzing this Haridra Ganda, so the ingredients are Haridra, Triphala, Dhruta, and Kshira. It is also Pitta Kapha Shamana, and the yogas are it has got Pitta Kapha Shamana yoga. The site of action is nothing but Koshta. Karma means Visha. It has got what we say, an extra indication, that is Vishahara, because the indications is Kodha, Sita, Pitta, and Udarta. But we all give this Haridra Ganda in type of allergic reactions, isn't it? Especially in respiratory allergy than the other type of disease, like this Sita, Pitta, and Kodha. What is this Kodha and Sita, Pitta? Asamyak Vamanodi, Kodha and Sita, Pitta are nothing, are almost Udarta and are almost similar. Sita Paniya Samsvarsha, Sita Gali Visheshata, Saraga Kandu Shokam Syadu Darda Saka. So the Haridraya Palanyashtu, Shakpalam, Havishastata is explained. Sita Pitta Udarta Kodhans, Saptaha Devanasi, the indication. So, how a medicine, Kodha is Kapha predominant, but we say Vada predominant. Sita Pitta is Pitta predominant. Udarta is Kapha predominant. How a single drug becomes effective in all the Vada, Pitta, and Kapha? Does it Tridosha Samana? I don't think so. But it's not Tridosha Samana, but it has got an action over all the doshas. How? It has got an effect on this Kodha, Sita, Pitta, and Udarta, because it is Vishahara in nature. So you can see these ingredients. You can just check the ingredients of this Haridra Ganda. Haridra Ganda is, again, as I told, fortified Nayopaya is Balajiragati, or fortified what we say, the another one I told you. Sorry, I forgot. So we can say that the base of this Haridra Ganda is nothing but Avibhatti Yoga. Almost similar yogas with the same kind of Avibhatti, the Avibhatti yogas, along with the Avibhatti yoga we know, Vyosha, Trijadaga, Ampoda, Tripikna, Amalagai Triva, Sarvai Sama, Samasita, Chaudrena Gurigata. Avibhatti Yamnama, Prasasta, Viktarogi. So these yogas, if we are adding Vibhidagi, Haridagi, Haridra, and Lohavasma, that yoga becomes Haridra Ganda. This is the difference. So Avibhatti is the one which has the medicine which has got Vishahara properties. So this here also, this Haridra Ganda becomes effective in all this kind of medicine disease, that is Pitta predominant, Sita Pitta, Kapha predominant Udarta, and Vada predominant Kodha. It is not due to Dosha Samanatva, but it is due to the Prabha like Vishahara. This is what I have to say about that. I think I have compiled almost all the common popular yogas available in the market. So probably now in the next part is Rasa drugs, that I think you have got a detailed class of this Rasa with another one, so I'm not going to it. So let me conclude my presentation here, that by saying that we need to evaluate each and every symptoms critically. Blindly, you are not supposed to give the Simulacra or Vyakhyati. These are not the universal drugs. Talisapatradi Churna or Talisapatradi Vadaga are not the universal drug. Agastya Rasayana is not the universal drug. These are the main things. But there are so many other yogas in our armamentarium. So always think over the indication and try to generate or try to understand the common properties of the yoga, and then you select the medicine. So if you do this, we can reduce the number of medicine, and thereby we can reduce the total cost of the treatment itself. Once again, I thank the organizer for giving me a chance. And if any doubts are there, I will be happy to clear that. If it is beyond my knowledge, I will just refer it and get back to you soon. Once again, thank you.
First of all, let me thank you, sir, for this wonderful session. Because as you had said, you have literally spoon-fed us with all the knowledge that you have gained through your practice, sir. Thank you so much for sharing your practical knowledge. Thank you so much. Sir, with your permission, if you're okay, we'll go for the discussion part.
Definitely. Sure.
Okay, sir. Sir, we have a few questions in the discussion chat box, so I'll just read it out for you.
Yes, sure.
So, first question from Dr. Divya Shri. Sir, please discuss about the Pradishyaya Chikitsa.
Pradishyaya Chikitsa, the main thing what we have to follow is Kleda Shoshana. So Ushna, the medicine should be Ushna Guna Pradhana. That should be Tishna as well as Kleda Shoshana. As I explained, the Grahi. Here we have to use the Grahi properties of medicine properly. I just touched that area in my presentation. So what is Grahi? That is Deepanam Padanam Yat Ushnatva Drava Shoshana. Here the excessive Drava Bhava is being expelled through the our nasal origin and nasal orifice. So we have to do the proper Pajana with the Grahi Drivya. The main Grahi Tacha Yatha Shuddhi Jeerakam Pichavippali. These are the simple drugs. At the same time, almost all the medicines with the Ushna, Ruksha and Tishna properties here are suitable in these conditions. In the acute rhinitis or the running nose condition, we can use especially the what we say the Viagra is very effective in such conditions. If it is the fever is not that much predominant. Viagra and the Simulacra are the medicines which we can give the Quada medicines and simple Jeeraka Churna is sufficient. The another one is the very best combination is the Kleda Shoshana, that is Tiktarasa is Kleda Shoshana. So almost all the Tiktarasa Pradhana Dravyas, that is Panja Tikta Kashaya or what we say Tiktakan Kwata, etc. are very effective in such conditions. And Arogyavardhini Vati is very effective. It has got the Kadurohini as with Tiktarasa, it's a Tiktarasa Pradhana Dravya. So Kadurohini, the Arogyavardhini is a very good